So, good day everyone. We are Group 3 and we are about to present and discuss our proposed laboratory model, which is named MedCore Advanced Laboratory Center. So, our laboratory is a privately owned, freestanding, and tertiary laboratory that it is an advanced diagnostic facility that operates independently from hospitals or government institutions and is owned by a private individual or corporation. As a freestanding laboratory, it is housed in its own dedicated building or space, allowing it to manage operations, equipment, and staffing without relying on a parent medical facility. Being a tertiary laboratory means it offers highly specialized and sophisticated diagnostic services, often including clinical chemistry, histopathology, immunology and serology, and other complex procedures that require expert personnel and advanced technology. So these laboratories our laboratory usually serve as a referral centers for primary and secondary laboratories, providing confirmatory tests, specialized diagnostics, and expert interpretation. So our independence and advanced capabilities allow us to deliver efficient, high quality results while maintaining flexibility in management, innovation, and service expansion.
Our vision describes what we want our laboratory to become in the future. We aim to be a leading and well recognized laboratory known for our commitment to high quality services, strong safety practices, and continuous improvement. This means we want to always advance, learn, and provide the best care for everyone who relies on our work. Our mission explains what we do every day to achieve our vision. We provide accurate, reliable, and timely diagnostic services to support healthcare professionals. By delivering correct and fast results, we help ensure better treatment decisions and improve patient care.
Okay, so let's proceed to the organizational chart of MedCore Advanced Laboratory Center. So firstly, we have medical director, which has another um, another medical technologist, which is the chief medical technologist, and under it we have the laboratory managers. So in medical director, it has two um, coding pathologists, which are the anatomic pathologists and clinical pathologists. So, anatomic pathologists, they are the physicians who diagnoses diseases by examining tissues, for example, biopsies or and surgical specimens, and also including cells or the cytology. So, in clinical pathologists, there are also a physicians who diagnoses disease by examining body fluids, the for example the blood, the urine, and etc. So they guide the operations of the clinical lab sections. So under it we have the chief medical technologist. So also we have the laboratory managers. So under the laboratory managers we have the supervisors, the different supervisors in each different sections. So yeah, we have the supervisors, say for example, the blood bank supervisors, the immunology or serology section supervisors, the clinical chemistry section supervisors, and so on and so forth. So, what are these supervisors? So, they are basically the specialized leaders. Say, for example, the clinical chemistry section supervisors. So, they are the one who manage the staff, the equipment, the quality control specific to their designated section, of course. So, of course, the under it we have the registered medical technologists. So they're the ones who performs and analyzes those complex laboratory tests. for example, on blood, on urine, etc. So their role is to help the physicians to diagnose and treat diseases. That's why if nagpapacheck up tayo, we that we should have, nagsasubmit tayo ng results before tayo magkaroon ng ng mga consultations to our physicians so they can give us the diagnosis. So, and additionally, we have the specimen procurement sections na under it is the phlebotomist. So is phlebotomist, they are the specialists responsible for the collection of blood specimens from patients that they got from, say for example, the venipuncture or the capillary collection of blood. So they also ensure the proper handling. So yep. So when we say specimen procurement section, so they are the control control point for all incoming samples. So this section is responsible for collecting, receiving, labeling, sorting, and processing of all the specimens that has been collected from the patients. So for example, the blood, the urine, tissue, or any specimens na makukuha from the patients. So they ensure the samples are correctly identified, logged into the system, and delivered to the correct testing section promptly and in say for example proper or let's say appropriate conditions. So under the supervisors, the managers, the chief medical technologies, and others, we have the administrative staff, the clerks, and the utility support staff. So, sila, sila yung nag-handle ng mga technical duties such as patient registrations, data entry, they manage paperworks, answering phones, and billings. So, they basically handle all the non-technical duties na ginagawa unlike the medical technologists, the supervisors, the laboratory managers, or the anatomic, the pathologists. So, yep. So that's all for the organizational chart of MedCore Advanced Laboratory Center. And yeah, this organizational chart. So this is the whole explanations, the summary of our organizational chart. So this chart is it outlines the clinical laboratory's workflow and reporting structure. So, as mentioned, the medical director oversees operations while the chief medical technologist manages administrative and technical tasks. So, also the specialized diagnostic oversight is provided by anatomic and clinical pathologist which is under the medical director. So it includes also their assistants. So next is each specialty section is supervised by section supervisors who manage medical technologists. On the specimen procurement supervisor oversees phlebotomist, while administrative clerk and utility staff support daily operations. So this structure basically ensures accountability, coordinated workflow, and adherence to laboratory standards. So that's all for the organizational charts.
So for the laboratory sections, the laboratory is divided into several key sections, each playing a vital role in medical diagnosis. So first, let's have hematology, which is responsible for analyzing blood cells, coagulation, and blood disorders. And second is clinical chemistry, measures chemical substances in blood and body fluids to evaluate organ function and metabolic status. And then third, we have immunology, serology, detects antibodies and antigens to diagnose infections and immune-related conditions. And then fourth, we have blood banking, or which is known immunohematology, conducts blood typing, screening, prepares safe blood products for transfusion. And then we have clinical microscopy, which examines urine, stool, body fluids, chemical, microscopic abnormalities. And then we have histopathology, or also known as cytology, study tissues, cells to identify abnormalities, infections, and cancer. And then lastly, we have bacteriology or microbiology, identifies bacteria and other pathogens to guide infection treatment. Now the SOPs will be discussed.
Clinical microscopy is a laboratory section that focuses on the examination of various body fluids, such as urine, stool, and semen, and other body fluids. It aims to detect infections, monitor organ function, and identify abnormalities that help in diagnosing and managing different health conditions. The common tests performed in clinical microscopy are urinalysis, fecalysis, semen analysis, and body fluid analysis. In clinical microscopy, we wear full PPE and follow safety rules when handling urine and stool. Urine is collected midstream, stool in clean containers, and all samples are labeled with patient's info, such as name, date. Urine is tested within 2 hours or refrigerated. Stool must stay clean, and we use microscopes, centrifuge, slides, and reagents like saline and iodine. Urine is centrifuge, centrifuge, and the sediment is checked under the microscope for cells, crystals, and bacteria. Stool is examined for eggs, cysts, and parasites. And we do daily quality checks, record results, and report abnormal findings. If needed, we clean equipment or repeat tests to ensure accurate results.
Histopathology and cytology are essential sections in medical technology laboratory, focusing on the microscopic examination of tissues and cells to detect abnormalities, infections, and cancer. These fields provide critical diagnostic information that guides patient management and treatment. In histopathology, tissues are processed, sectioned, and stained to reveal structural changes, while cytology emphasizes the study of individual cells for early detection of diseases. Common diagnostic tests include biopsy processing with hematoxylin and eosin staining, which highlights tissue architectures and cellular detail. The pap smear, a cytological test used for early detection for cervical cancer. And fine needle aspiration cytology, or FNAC, a minimally invasive procedure that collects cells from suspicious masses. And immunohistochemistry, which uses antigen and antibody reactions. To ensure safety and reliability, standard operating procedures must be followed. Personnel should wear complete PPE and handle fixative and solvents with caution. Specimen must be properly labeled and documented before processing. Hazardous chemicals such as formalin and xylene should be managed in fume hoods to reduce exposure. Equipments like tissue processors and microtomes must be maintained regularly. Waste disposal should follow approved protocols and all findings must be documented clearly.
Bacteriology or microbiology section. This section is focuses on the study of bacteria and other disease-causing microorganisms to aid in diagnosing infectious diseases. Some of the common tests performed here include gram staining, culture and sensitivity testing, acid-fast staining for tuberculosis, antibiotic susceptibility testing, and various motility and biochemical tests. Before entering the area, ensure that you are wearing complete personal protective equipment or the PPE and strictly follow all biosafety precautions. And also, we do proper labeling and correct specimen collections are essential, as well as the timely processing of samples to maintain their integrity. When handling infectious agents, always use a biosafety cabinet and apply aseptic techniques at all times. We also perform routine equipment checks and instruments calibration along with scheduled disinfection of work areas to ensure accuracy and safety. All biological waste must be disposed of into autoclave safe containers, followed by appropriate sterilization and decontamination procedures to prevent contamination. Finally, all laboratory findings must be accurately documented, organism must be verified, and significant pathogen should be reported following established reporting guidelines. So this section plays a crucial role in identifying infectious agents and guiding effective treatment decisions.
For blood banking or immunohematology, we are responsible for blood typing, screening, and preparing blood products for transfusion. The common tests performed here are ABO and RH blood typing, cross-matching, antibody screening and identification, compatibility testing, preparation of packed RBCs, platelets, and plasma. And for the safety and quality management features of blood banking, we must be able to identify patients and collect labeled samples correctly, perform ABO and RH typing and antibody screening, cross-match compatible units, store components at correct temperatures, issue, issue blood with full verification, investigate any transfusion reactions, and maintain quality control, documentation, and equipment checks.
For hematology, this focuses on the study and analysis of blood, blood forming organs, and blood related disorders. It involves conducting various tests, such as complete blood counts, blood smears, and coagulation studies, to diagnose and monitor diseases like anemia, leukemia, and clotting disorders. It also helps in evaluating blood cell morphology and blood pathogens. In this section, you must wear full PPE and follow standard precautions, ensure proper specimen labeling and correct mixing of tubes, perform daily QC and calibrate analyzers before running tests, keep the workstation clean and dispose of sharps safely, validate results, repeat any flag tests, and document all findings accurately.
For the clinical chemistry section, clinical chemistry evaluates chemicals in the blood and other body fluids to give a clear picture of organ function, metabolic activity, and overall physiological balance. It detects problems in key processes like kidney, filtration, liver metabolism, electrolyte stability, and hormone regulation. These tests help diagnose disease, track treatment progress, and enable early identification of health conditions. For the common tests in this section, glucose, cholesterol, triglycerides, liver function tests, kidney function tests, electrolyte tests, and enzyme and hormone tests, and as well as cardiac markers. In this section, the usage of PPE must consistently be worn, and the handling of reagents according to their STS. Check serum or plasma for hemolysis, lipemia, or icterus, and apply rejection criteria when necessary. Perform daily quality control with proper calibrated analyzers, operate centrifuges by safety balancing tubes and waiting for a full stop before opening, and accurately document results, verify critical values, and follow corrective actions when quality control fails.
For the last section, which is immunology and serology section, it is the section of the laboratory focuses on detecting antibodies, the proteins produced by the immune system, and antigens, foreign substances such as bacteria, viruses, and toxins present in a patient's blood. These tests help determine whether the body is currently fighting an infection, has been exposed to a pathogen in the past, or is experiencing an abnormal immune response. Serology is essential in diagnosing infectious diseases, autoimmune disorders, allergic reactions, and inflammatory conditions, making it one of the most important areas in the clinical diagnostics. Common, common tests performed include rapid tests, which is HIV, hepatitis, dengue, and syphilis, provide is quick screening results by detecting specific antibodies or antigens, especially useful in emergency settings or mass testing. Also Salmonella, bacteria to help diagnose typhoid fever. And also CRP or C-reactive protein measures inflammation in the body and is useful in detecting infections, sepsis, and chronic inflammatory diseases. Overall, the immunology serology section provides critical information about a patient's immune status and plays a major role in early detection, treatment decisions, and monitoring of various diseases.
here's our 2D floor plan. And we will be discussing the other functional sections that wasn't discussed earlier. So, first is we have reception and waiting area for patient intake and comfort. And we also have specimen collection room, dedicated space for safe and private sample collection. And then and we have hematology, chemistry, and microbiology labs. Each section contains specialized equipment like centrifuge, spectrophometers, incubators, and biosafety cabinets. Next, let's have histopathology section, includes microtome, tissue processor, embedding center, and staining set. And then we have molecular biology area, equipped with PCR machine and electrophoresis apparatus. And then we have storage and preparation rooms for reagents, samples, and equipment setup. And lastly, we have staff workstations and conference room for documentation, analysis, and collaboration. Now, we also have safety utility features, and our laboratory has CCTV cameras strategically placed for security and monitoring. We have fire extinguishers accessible in key areas for fire emergencies. We have emergency shower and eye wash station installed for chemical exposure incidents. We also have bathrooms available for staff and patient use. We have fume hood and biosafety cabinet to ensure safety handling of hazardous materials. And lastly, we have water purification and distillation system. It supports clean, sterile lab operations.
So that concludes our presentation for our laboratory, which is the MedCore Advanced Laboratory Center. So here is our preferences. That's all. Thank you.